were koma mavutu siga were siga were siga were ine koma mavutu siga were siga were siga were ine koma mavutu siga were siga were siga were ine koma mavutu tatuluka inendende inogumuti akunika so wakatu akutindine akunikwila so wakundini sikundiwawa sikundiwawa ine sikundiwawa sikundiwewe sikundiwawa sikundiwawa ine sikundiwawa siga were siga were siga were koma mavutu siga were siga were siga were ine koma mavutu siga were siga were siga were ine koma mavutu siga were siga were siga were ine koma mavutu.
My name is Ellen Chirwa. I'm the GAIA board chair. And I've known GAIA for the past 20 years. GAIA has significantly contributed to the health and well-being of our people. Most Malawians live in the rural areas, and access to services is a challenge. They have to walk long distances, and sometimes they reach the hospital, there are no medications, but GAIA has brought services to the people in the communities. So GAIA has touched many lives, the young people, the old people, the children. I always believe that the best thing you can do for a fellow human being is to add value to their lives. GAIA has added values to our Malawians because they have really helped us. So I would like to thank GAIA US for their continued support. I'd like to thank GAIA Malawi team for their hard work and commitment. And in the future, I'd like to see us expanding beyond Mulanje and Palombe to provide the needs to other people as resources provide, and also to continue addressing the prevailing health needs in our nation. Thank you, GAIA. Congratulations for clocking 20 years of human service to Malawians. Thank you.
Congratulations for all the terrific work that you're doing in Malawi. We have a very strong attachment to that country.
Hi, I'm Tom Brokaw, and I've been a journalist for 55 years now. And one of the things that always impresses me most is to go to the third world and see all the Americans who are there helping the people who don't have what we take for granted. And what you're doing in Malawi is a perfect example of that. Meredith and I offer our most heartfelt congratulations and wish you all the best.
Hi, I'm Anne Lamott, and I'm honored to add my congratulations on your 20th anniversary. I've loved GAIA since Bill Rankin first told me about it 20 years ago and sucked me into the community of people who are so grateful for your service in the world.
Good afternoon, good evening, and welcome aboard. On behalf of GAIA, welcome to this flight. I hope you've been enjoying the pre-flight entertainment. There's much more of that to come. My name is Jamie McDonald, and I am your virtual pilot for this evening. I am also your fundraiser. The flight tonight will take approximately 40 minutes, and we will be cruising at an altitude of, well, that's very much up to you this evening. By now, you should have your in-flight meal on your tray table. It should have arrived in the post, and you certainly should have your GAIA Lounge cocktail sitting next to you. You have a few moments before we really get started to refresh that cocktail. It's very important you don't get thirsty. What else can I say? We're so excited about this evening. Thank you for allowing us to use these flight analogies. We do appreciate the legroom. That's the last one. As I say, I'm your fundraiser. I'm going to be back with you in about 20 to 25 minutes. Very importantly, if you have registered, thank you so much. If you haven't, you will see the website is right here, www.gaia20in20.com. That is how you can register and put your payment details in before you donate. You can also use the QR code on your phone, but also know that you can put your credit card details in after you donate. You can also pay by check. And the last thing I will say is if you do want to donate anonymously, there is that option too. That is a lot of information, and I'm going to explain it in even more detail when I see you again. It's going to be a great evening. I'm so excited, and it is my pleasure and honor to hand you over now to Executive Director Todd Schaefer. Todd?
Good evening, everybody. Thank you for being here. You know, a year ago when we started envisioning the 20th anniversary gala, I was seeing like glass-walled ballroom overlooking the San Francisco Bay. But then 2020 happened, and here we are with a virtual event. Well, let nobody kid you. Putting on a virtual event is a bigger undertaking than a live event, and it was only possible by an extraordinary event committee and extraordinary staff members making it possible. But let's do plan to get together in person one of these days soon. And when we do that, let's have a dress code that's more formal than pajama casual. So 20 years. It's the blink of an eye in historical terms, but it's an eternity for those engaged in the heat of battle. Just ask California's firefighters right out here. Just ask the nurses in America's hospitals fighting COVID, or GAIA's frontline workers fighting HIV and other deadly diseases for 20 years. Now, in that time, we've seen remarkable progress. I mean, more than remarkable progress, unthinkable progress. From the time that we started at the peak of the epidemic to today, annual AIDS deaths in Malawi are down by more than 80%. That's 80%. New infections are down by roughly 2/3. And the number of babies born HIV positive, the number of orphans created as a result of those AIDS deaths, has fallen precipitously. Now, I would never claim that GAIA is solely or even primarily responsible for those national improvements. But it is indisputable that GAIA's frontline workers have been on the forefront of fighting that HIV blaze every day for 20 years. There's also no danger of GAIA declaring victory and packing up and leaving. We know all too well the dangers of backsliding. We know that those hard-fought gains can be squandered. We know also that the country faces other health challenges, such as malaria, pneumonia, and COVID, that are intertwined with HIV, and that backsliding on any of those, failure in the face of any of those, imperils the gains on the others. GAIA was never about just HIV. Yes, it was the spark that launched us, but the kindling was injustice, it was inequity, and it was a lack of access to care. Soon you'll hear from Joyce Jerry, GAIA's country director, who is a nurse. And through her nurse's eyes, she's constantly reminding us that we need to look beyond the test result and see how the patient is doing. She always says we mustn't have blinders on. When a malnourished, frightened, pregnant teenage girl comes into our clinic for a prenatal HIV test, she's looking for a lot more than just the result of that test. And GAIA stands ready to listen to her and respond. And that's possible because we're different. GAIA, first of all, is truly local. Yes, those of us in the US are doing fundraising, we're providing some technical assistance, but the entire team on the ground in Malawi, 100% of the team on the ground in Malawi, from the leadership to the clinical staff to the support team, they're from the communities that we serve. They're Malawian, and it makes a difference. Secondly, that nurse's ethos that Joyce points to really makes us patient-centered. And whether that patient is defined as an individual or a whole community, that too makes a difference. Thirdly, we believe in partnerships. GAIA never goes it alone. Yes, we innovate and create new programs, but when we do that, we start with a conversation with the communities that we're about to serve. And we do it in coordination and collaboration with the Ministry of Health to ensure sustainability. We also leverage our successes by partnering with other NGOs, whether they be local or international. And finally, GAIA is in it for the long haul. We go deep. We will never sprinkle the largest possible landscape with projects. Instead, we make sure that we're not contributing to the rusting husks of well-intentioned projects that litter Africa. Sustainable impact requires time, relationships, and trust. And for the past 20 years, we've been developing those relationships, and that trust is in the bank. We'll be drawing upon it for the next 20. Thank you for joining us tonight. I look forward to talking to you again later. But for now, it's my pleasure to introduce the man more responsible than any of us for the journey we're all on together. It's the Reverend Dr. Bill Rankin.
My name is Bill Rankin. I am a co-founder and the first president and CEO of GAIA. My dear friend Charlie Wilson and I, back in the year 2000, were greatly concerned about the unusual number of deaths on the East African side of that continent, the Indian Ocean side. Particularly, we were alarmed at the fact that about 2,000 infants every day were born HIV positive to HIV positive mothers. Long story short is that Charlie identified a medication which would be simple to distribute and could be used to lower greatly the probability that HIV positive women would transfer the virus to their infants. We decided the trick was to find a way to get this medication to the villages where we knew a great majority of African people live. We thought, after considerable study, that the best way to do this in the poorest African countries would be to go through religious organizations, which usually constituted the only available infrastructure in those impoverished areas. We thought that with a little luck and a lot of help, we might be able to train religious people to be caregivers to the home-based care patients and caregivers to the orphans. There were and are lots of orphans in those villages, and also HIV prevention educators there. We devised a scheme to try to do this and took it to several researchers and clinicians in infectious diseases at UCSF. They included, by the way, Paul Volberding, Jay Levy, who was a co-discoverer of HIV, Richard Feacham, who went on to be the UN founding executive director of the Global Fund, and Art Amin and his colleague, Natasha Martin. All of these people and others said, just do it. So we did. And what happened afterward that was most extraordinary is that people, mainly in California to begin with, but subsequently throughout the country and beyond, got behind this idea so that these days, with racism, xenophobia, misogyny, and other ills operating so dreadfully in our time, our donors rose to the occasion and simply exercised their compassion as sisters and brothers to people whom they would never meet. The result was extraordinary generosity and kindness that enables the great staff we have in the United States and in Malawi to do this remarkable work of saving the lives of the poorest of the poor.
Greetings from Lilongwe, Malawi, the warm heart of Africa. My name is Monica Chakwera, First Lady of the Republic of Malawi. On behalf of my husband, His Excellency President Dr. Lazarus McCarthy Chakwera, my family, and my country, I am pleased to offer thanks and congratulations to the Global AIDS Interfaith Alliance as it marks 20 years of service to our citizens. Global AIDS Interfaith Alliance Malawi opened its door at a time of deep despair for us, as more than 1,000 Malawians died of AIDS each week, leaving behind scores of orphans. But with coordinated efforts of committed partners, including the exemplary contributions of Global AIDS Interfaith Alliance, we have reduced that rate by more than 75%. Today, we can imagine a world without AIDS, a world where young girls no longer die in childbirth, a world where malaria no longer ravages our younger citizens. We will get there together. Thank you for your contributions, Global AIDS Interfaith Alliance, and we look forward to another 20 years working together.
Thank you, our First Lady of Malawi. Good evening, everyone. I'm Joyce Chere, GAIA's Malawi Country Director. I wish we could be together in person tonight, but 2020 has been full of changes and challenges. However, as our First Lady has pointed out, we have a lot to celebrate this year, including GAIA's 20th anniversary and many milestones we have made towards better healthcare coverage and AIDS-free world. These milestones have been made possible by an incredible team of frontline health workers who tirelessly provide quality care in rural remote areas. Our team in Malawi extends a special thank you to all of you who have supported our work. Your donations have allowed us to adapt to programs to the ever-changing health needs in Malawi. Your contributions have saved and improved many lives. You have helped us build a better tomorrow. And tonight, we look back to 20 years. We all have done and all what we have learned. And tomorrow, we will wake up prepared and inspired and take on the next 20 years to improve millions of lives. And with all our efforts together, it will be. Thank you very much, everyone.
Warm greetings to you all. My name is Tony Fauci, and I'm director of the National Institute of Allergy and Infectious Diseases at the National Institutes of Health. I want to congratulate the Global AIDS Interfaith Alliance on your 20th anniversary. Through your partnership with the Malawi Ministry of Health, you have made major strides in addressing gaps in rural health care to better manage the HIV epidemic and other diseases in Malawi, one of the African countries most affected by HIV. Your efforts have contributed to creating a better future for the country and its people. Thank you, GAIA.
Congratulations, GAIA! Now, in the 1990s, I visited Africa with President Bill Clinton and witnessed the devastating impact of the AIDS epidemic firsthand. That was shortly before GAIA came into existence. I cannot overstate how badly you were needed. So now on your 20th anniversary, there is a clear goal of ending the epidemic altogether. So keep it going, GAIA. Congrats.
Congratulations, GAIA, on 20 remarkable years. I've been very impressed with the contributions you've made towards the HIV/AIDS challenge. I really appreciated my recent visit to Malawi, where I saw your work personally. GAIA is doing a wonderful job as a role model for Africa and resource-limited countries. Keep up the good work. Thank you very much.
20 years ago, Bill and Charlie made a plan. Do something about AIDS in Africa. To Malawi off they ran and said there, yes we can, get to 90-90-90. Call it GAIA, Lord knows why. Now things are looking grand. 390's close at hand. You go, GAIA.
When I was a child, I dreamt of a world where my parents weren't sick, where I didn't fall ill every rainy season, where my parents could work and I could go to school without interruption. I dreamt that my family could access the healthcare they needed. Oh yes, a world focused on life and not death. One where geography does not determine health. A world where we could thrive. Then it became my dream to change things. Today, I work with GAIA to turn that dream into a reality for my family and for the communities that we serve. At GAIA, we believe that everyone deserves access to healthcare, no matter where they live or who they are. Bringing health services closer to people is what we believe in. Our team in Malawi is 100% committed, 100% compassionate, and 100% local. Our upbringing, the challenges that we face, helps us to understand what it means to have access to healthcare services. We have a well-trained team and expertise to solve our problems. I am Nelson Kozomba, GAIA Programs Manager, and I want to introduce my colleague, Edina Bologonya, GAIA Nurse Coordinator.
Currently, I'm working with GAIA. As a follow-up coordinator, what I do, when the client tests HIV positive, is when we refer that client to the nearest health facility. Then I make an appointment to meet the client right at her or his home. So I'm very proud because so many have been saved.
Our frontline health workers prevent and tackle today's health problems, while those who become nurses and midwives supported by our health worker training program are improving the systems for tomorrow. It is not easy to make such strides in our environment. Partnerships with local government and other stakeholders has been a key to strengthening the existing healthcare grid at the far end of the road. And though we currently work in one small but important corner of the world, we are hungry to achieve the United Nations Sustainable Development Goal number 3, ensuring health lives and promoting well-being for all. We also have sights set on universal health coverage, equal access to quality care, especially for the most vulnerable living far off the healthcare grid. From my personal experience, I know that when there is health, there is prosperity. And when there is hope, there is meaningful growth. GAIA operates 6 mobile health clinics that nimbly and effectively fill gaps in the existing healthcare grid, making quality primary healthcare available to over 1.1 million rural Malawians across 2 southern districts. In addition, our team incorporates community outreach and education, including access to youth-friendly and sexually reproductive health services and community-based HIV testing services, which aim to prevent the spread of HIV and link people living with AIDS to life-saving treatment and education. Through 2 million clinic visits, we have administered over 100,000 HIV tests, treated 440,000 potentially life-threatening cases of malaria, and 90,000 cases of pneumonia, a key driver of under 5 mortality. And we have given more than 60,000 reproductive health consultations. Although we have made such progress, Malawi faces a huge deficit in its healthcare workforce, with over 60% of nursing positions unfilled, which translates to extremely long and dangerous waiting in for most of the rural fixed clinics, which are often staffed with only one nurse at a time. To make sure that we have trained and skilled nursing workforce, GAIA works closely with local universities and provides comprehensive support to underprivileged nursing scholars, enabling them to complete their education and certification and pursue a career on the front line. These young women and men have started to put a significant dent in Malawi's chronic shortage of health professionals. To date, 473 nurses and midwives have graduated with GAIA's support. Over 90% of these professionals work in government facilities which serve over 80% of Malawians. At the community level, GAIA empowers young men and women by training them in HIV education, HIV testing, linkage to care for those who test positive. This is essential in enabling communities to participate in issues that affect them. The success of GAIA's targeted approaches is evident in our own clinics, where we have seen a decrease in positive HIV test results from 23% in 2008 to just 4% in 2020. We are extremely proud to have contributed to improved health in Malawi, where annual AIDS-related deaths have decreased by 65% in less than 10 years, and annual rates of new HIV infections have dropped by 55%. This impact is a product of 20 years of GAIA's innovations supported by local leaders, building trust with local communities, building relationships with local government and the Ministry of Health, as well as building partnerships with other NGOs, institutions, and donors. We believe in the power of partnerships. GAIA's approach is constantly shaped by implementation science research and program evaluation undertaken with research partners, sector-wide studies, as well as listening intently to our community. We have learned from our past and we innovate for the future. We love to say that the best way to predict the future is to make it. Your role is significant. Help us build the world where all have access to the healthcare they deserve.
That was good for the soul, wasn't it? I know for a number of you watching tonight, like me, you had plans to spend part of 2020 in Malawi for our 20th year celebration. I know the team from Elizabeth Taylor AIDS Foundation was planning to go. I know that the Gruber Family Foundation was planning to go. The Hamels Foundation routinely goes. Agnes, Kitty, Don, Lori, and the entire board of directors of GAIA was going to meet in Malawi this year. So absent that, it was good to see even through video the warm heart of Africa, and really I loved hearing the voice of Nelson Kazomba. So now we arrive at the point in our celebration that we've all been waiting for. I say that somewhat facetiously, but I actually mean it. Bill Rankin talks about the incredible generosity of our donors that have stepped up and made us bigger than we ever thought we could be. That's been my experience here too. And now through our live appeal, which is the next thing on the agenda, you'll have that opportunity. Now, our live appeal, for those of you who have not been to a GAIA event before, is not like an auction. You don't place a bid that you may or may not win. In fact, if you bid, you win. You win the chance to have a significant impact. Now, one of GAIA's strengths is that we have, over 20 years, been incredibly financially stable and growing. But we also live really close to the bone. We run a tight ship. We start every year with very little money in the bank, an ambitious program plan, and the vaguest idea of how we're going to raise the money and spend it in the same year. That's the case now as well. And so we've estimated now that from now until the end of the year, and to set us up to get launched into a prosperous and successful 2021, tonight we set a goal of $300,000. Now, $300,000 is sufficient to operate 3 of our mobile health clinics for 6 months. That's 60,000 patient visits. In addition, it's enough to support 40 of our nursing scholars through their year of nursing college that started just last month. And it's also enough to support hundreds of those orphans that Bill Rankin talked about. Now, the good news is, because of the generosity of our sponsors and because of the tickets that you purchased before the night began, we're already halfway to that goal. Now, don't worry. If by some miracle we actually already make it there tonight and exceed that goal, that means that every additional dollar is additional impact. And we are literally setting the stage for a more ambitious 2021 budget. So I look forward to joyful giving, and I'll be joining you. I now turn it over to Jamie McDonald, tonight's captain and our auctioneer.
Todd, thank you very much indeed, and let's get started. But to all of you at home, hold tight for just 1 second. We are going to land this plane together, and I need to make sure the wheels are out first. So just a couple of last minute admin things. If you haven't registered, as I say, you don't need to, because you could put your credit card details in after you donate. But if you do want to register, here is the website again, GAIA20in20.com. And just a word about those who do prefer to pay by checks. Todd's very keen to find out what our commitment is today. So could you email info@thegaia.org, or if you prefer, there is a chat box in the Zoom platform that you're currently watching this. If you see there's a chat box, you can send a message to the GAIA team. There's someone on standby to write straight back to you if you would like to commit to donating a certain amount that way, and you'll be sending a check in later. As I say, all the donations can be anonymous. You can, of course, say who you are, and I'd love to shout your name out from the rooftops and say a big jumbo jet thank you for your donation. But that is those are the rules of the game, and what's more to say other than I'm so excited? And what's the time? 31 minutes past. So in about the next 11 minutes, we are going to decide about the next 12 months of this organization and beyond. It's extremely exciting, and I'm raring to go. I hope you are too. So sit back, relax, maybe just top up your cocktail, and let's see how far we go. Right, we are going to begin at the $10,000 level. $10,000 is the funding for 1 month of a mobile health clinic, and they can reach 3,500 patient visits. It's a huge amount of money, but what I do know is that some of the donors of those organizations are so loyal, and if you are one of those people, please look at this. I can see the total coming in. Thank you, Marty. Thank you, Jody. We're already to $30,000. If you know someone who you think's got the firepower to possibly donate $10,000, give them a bit of a word of encouragement. Maybe you're sitting next to one of those people now. And don't worry, we're not in a huge rush. You have got time. I just want to make sure that those people who do want to donate $10,000 don't see me go on to the next level and think they can't then donate. You have got time to do so, but if you can donate $10,000 to the mobile health clinics, which are really the backbone of this organization, please do so now. There, I just saw one come in. Perhaps that was Bruce or David. We're up to 41,000 already. This is great stuff. We're breaking through $200,000. Okay, let's keep it going. We're through the $200,000 and we'll be marching our way up towards $300,000. This is great. Thank you, Andrew. The Parish family, thank you so much. 65, this is great. Whew. Okay, take a breath. $5,000 is the next level. If $5,000 is an amount that you think you can donate, it is the annual salary of a nurse for one of those mobile health clinics. What can I say? This year has been a very difficult one for so many people, not just financially, but if there was a trip that was planned or a trip you couldn't make, and maybe you do have that $5,000 available, is that something that you think could be put to this use? These nurses can touch the lives of up to 40,000 people. Can you imagine $5,000 touching 40,000 people? It's just an enormous reach. And if that's something you can do, look at this. We go Richard Stores, Suzanne. This is amazing. We're heading up towards $80,000. Please keep the donations coming in. I really feel there's an energy coming now. $82,000. This is great. Okay, let's just pause for a second. Again, if you have that cocktail next to you, feel free to top it up. As we approach the $100,000. This is wonderful. Please keep these donations coming in. As I say, this is very much a team event. If you know there's people watching, send them a message, give them a word of encouragement. All the videos you've seen today just shows you how far every single dollar goes. Moving down a level to 2,500, a particularly popular program, the Nurse Scholarship Program. This is an annual funding for the health workers support staff. Training for a year. I think I saw in the video it's 473 graduates already, which is just an amazing accomplishment because those people that are trained obviously go on to pass on their skills and it becomes a positive momentum. If $2,500 is a level that you feel comfortable donating at, please donate at that level now. $2,500, come on, it would take us through $100,000. Wouldn't that be great? Here they come. Margaret, Michael, Chris, Mr. J. Levy, thank you so much indeed. Brittany, Diane and John Cope, thank you so much, taking us right through $100,000, $105,000, $106,000. Come on, we've got to make it to that $150,000. If you know people who've got the firepower for those bigger donations, let's see if we can't get up there. I'm just pausing for a second, not because I don't know what to say next. I'm just so excited about how this is going. Okay, the next level, $1,000. I should also mention for anyone that may have donated prior to the event, of course, that does not stop you from donating tonight. If you are one of the larger donors who may have done so already, perhaps $1,000 is a number that you feel comfortable topping up with, especially when you find out how far it goes. $1,000 is for those rural communities who possibly got a lot of HIV cases, and it can test up to 200 households. Not even 200 individuals, this is 200 households for $1,000. Can you imagine stopping the spread of HIV in these rural communities? What a huge impact that has. And if that is something that resonates with you, then please do donate $1,000, and please, if you could do it now, that would be great. 132,000. This is great. Come on, like 136,000. Oh my gosh, Mark and Jean Farmer, Lynn and Dan, Janet, Elizabeth. This is all great stuff. I can see there's so many people donating now. I just, to all of you who are donating, a huge thank you. If you don't feel great, you absolutely should. $500. $500. The awful disease of malaria, which affects so many young children. This is treatment for 500 kids with malaria under the age of 5. If malaria is something you've experienced, we probably take it for granted in the Western world, either before we go to malarial countries or when we get back. But just $500 can treat 500 children under the age of 5. Maybe that Canada Goose winter jacket you were going to buy this year, you don't need to. You can still use the one you had last time. So $500, we're through 150,000, up to 160,000. This is so fantastic. You should all be patting yourselves on the back. But I realize we still haven't finished the levels. So I will keep going through the levels as we get to the slightly smaller amounts. $250 is support for educational supplies for orphans. I know this is something that Bill Rankin spoke a lot about. And it goes without saying that children are the future and education is the way to get them there. So if $250, a couple of theatre tickets that you haven't had the chance to go to this year, if that's something you feel good about, then $250, please do donate it now. Thank you so, so much. Look at this total. Bill Herman, Lisa, Melanie, Anita, what a fan. Can you believe we're raising this amount of money in 2020? What an amazing validation for this organization from such supporters. It's been such a difficult year, but all of you at home have come out, and you've come out with vigor. And here we are, we're cruising towards $200,000. Let's get to $200,000 as I go to the next level. $100. Technology is something obviously we'll take for granted, but these tablets for nurse scholars are something that can help them out in an enormous way. So $100 a meal out in New York City, if that's something that you can contribute and you haven't contributed yet, I promise you, if you have it, you will feel good about donating it. It gives you that connection with this organization. Goodness me, we have a very large. Yeah, let me know, production team, if I can say that person's name. I don't want to announce anyone if I'm not allowed to, but we've had a very wonderful donation that I will read out shortly if I'm allowed to. Going down one more level, the last level is $50, and I sort of feel like everyone might be able to donate $50, especially when you find out it's for PPE equipment. I mean, that's something in the Western world that everyone got to use. Oh, goodness me. But the PPE equipment is so vital for people in Malawi and for GAIA. I was talking to Todd earlier, so he was telling me that, back when GAIA started, the mountain they had to climb was already so difficult. I mean, to try and take on such a vastly spreading virus, and then to have COVID happen again. So they're doing all of this stuff, social distancing. They're having to do it, with COVID around, and, in PPE gear, it makes it particularly difficult, but they're doing it and they're doing their job. And just $50, if you can afford to do that, that gets them that equipment. Yes, I can say, Mr. David Arscott, just say thank you so much. Our top donor, $18,500. This is amazing. Look at this. We're blasted through 200,000, 210. Please do keep them coming in. Whew. This has been so fantastic. The very last thing I'll say is that there is an option to give whatever you like. And I'll just tell you this one story because I heard of someone else doing this. I thought it was a nice touch. They had a baby girl earlier this year on the 23rd of June. And so they decided to donate $623, $623, because they wanted to donate something that really meant something to them. So there just is that option. If you want to donate any other amount, then of course you can do that. Well, look at this, $212,000 and climbing. This is such a great result. I know that Todd's going to be so, so happy with this. I will say to any of you who are writing in with a check, as I say, use the chat box in Zoom or write an email to info@thegaia.org. That's info@thegaia.org. It's been nothing other than an absolute pleasure being your fundraiser this evening. We have kept it to 40 minutes, so I think we may have even landed the plane on time. And as I say, my name is Jamie McDonald. It's been a pleasure being your virtual pilot this evening, and I will hand back over to your trusty Executive Director, Mr. Todd Schaefer. Todd.
That's amazing. When tonight started, I was positive that my highlight was going to be Michael Gottlieb rapping. I was sure that that was going to be the highlight. But somehow you blew it away with the live appeal. Inspiring. And I commit to all of you that, we don't know what the exact numbers are. I can assure you that with the money that was raised before and the money that was raised tonight, we blew away our goal for our target for the evening. But tomorrow I will send all of you in attendance preliminary totals and maybe final totals in about a week, because some people may have already sent something in, they were unable to attend, and we'll tack them on afterwards. But it's absolutely remarkable. I say with gratitude, with 20 years of gratitude, not just tonight. Zikomo Kwambiri. Now, that wraps up our program. But top up your beverage, sit back and relax. Our work is done, your work is done. We have a few more people, a few more supporters that would like to say a few words. Listen to them, and then we'll wrap up with a musical contribution by Naomi Wachira, a wonderful Kenyan songwriter and singer who some of you met a few years ago, back when we were able to hold events in person. Enjoy. Thanks again, everybody. Zikomo.
Hey, this is Scott Wolf wishing a happy 20th anniversary to GAIA. On behalf of my wife Kelly and I, we were lucky enough to get the chance to see the incredible work that GAIA does firsthand and up close. We've been lucky enough to travel around through different parts of Africa and seeing some incredible organizations, but never have we seen such a remarkable impact at a community level like we did watching GAIA do their work. This is a model that should be replicated over and over, but in order to do that, you might have to replicate the amazing Joyce and her incredible Malawian staff, which is a tall order. Thank you, GAIA, for all of the lives you've changed, for allowing us to be a tiny little part of that. Happy 20th anniversary. Congratulations.
Hi, I'm Alexandra D'Addario, and I just wanted to wish GAIA a happy 20th anniversary. I'm so honored that I had the opportunity to go to Malawi to see firsthand the incredible work GAIA is doing, and I'm grateful for the work that you guys do, and to 20 more great years. Happy anniversary.
Congratulations, GAIA, on 20, yes, 20 impactful years. Your programs are so important because they continue to provide the much needed healthcare in resource-deprived regions of Africa. And as a proud Nigerian American, a daughter of the diaspora, you are helping pave the way for the next generation. So once again, congrats.
Hello, my name is Nema Washira, and
my name is Diana Rosemary.
And we would like to wish GAIA a wonderful, wonderful 20th anniversary. We first discovered GAIA through Chris Brent back in 2016, I believe, when we both came down to the Spring Gala. And we just love that there are people out there who are fighting for those who are marginalized, for those who don't have the resources to fight diseases such as HIV or pneumonia or malaria. And yeah, we just want to wish you a wonderful, wonderful 20th anniversary to all those in the front line who are fighting for the lives of others.
Thank you for your life-saving work.
Yes.
Now I've been wondering, I've been trying to figure out who this brown skin girl is. I've been on a quest, I've been on a journey, trying to understand why on earth I am here. And I've discovered I am the sum of everybody I've met. Some have blessed me, some have cursed me, some have held me down, and others pushed me aside. And that there are days it feels like we're back on the playground again, defending our right to be here. Now I've been pondering, I've been trying to find the thread, the invisible thread that binds us together. And I've discovered we are the same in our existence. Sometimes we're afraid, sometimes we are bold, sometimes we can fight, and other times we just run and run and run. And then there are days it feels like we're back on the playground again, defending our right to be here, defending our right to be here. I am 'cause you are 'cause I am. So be kind to me, and I'll do the same atupe amani, atupe upendo, fadhili, yeah, 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 oh, oh, I am because you are because I am, because I am because you are because I am, because I am.